If you're new to the skincare game, there is a lot of information and it can get really confusing very quickly, except you're dealing with specific skincare issues such as acne, melasma, hyperpigmentation, significant skincare issues, in which I suggest you speak to a professional. Then you just want to stick to the basics, and the basics being cleanser, moisturizer, and sunscreen. Honestly, it's not much more complicated than that, but yeah, you can expand, or if you wanted to treat some specific things, then you can now start expanding your skincare routine. But really, you want to start with the basics, because if you're just starting, it's very easy to get off the handle and not be able to keep up with it if it gets too confusing. 7-step routines and 10-step routines. Like, I just always knew that wasn't for me. Allow me to quickly say that before you start, you want to know your skincare type. Do you have a dry skin, oily skin, normal skin, or sensitive skin? My skin is dry, and how I knew that was that whenever I just finished having my bath or I just washed my face will feel so tight, except I put a moisturizer on. So yes, my skin is dry. So you want to know your skincare type, because that would help in the selection of the products that you want to use, because different products are suited better for different skin types. So I'm going to show you the products that I use, but before I go on, So yes, my skin is dry, so most of my skincare products are for dry skin. Like I said, you want to know your type of skin, as that would help influence the skincare products that you use. So I usually start with a cleanser, and I use this CeraVe hydrating cleanser. I like how it looks. I was using this cleanser previously. I got the recommendation from Instagram. Yeah, I was like, oh, Korean beauty and all of that. I didn't mind. It wasn't bad, but it's finished now, so I used this one. And then after cleansing my face, I wash it. And then in the daytime, I use a vitamin C serum. I use La Roche-Posay. If it's in the night, after washing, I use retinol. I'm just starting on retinol, so I use a very small quantity. After that, then I put in a moisturizer. I use my moisturizer. So I use Cetaphil moisturizer. As you can see, that's for normal or dry skin. And during the day, I just finish that off with a sunscreen. That's it. So yes, like I said, you want to start with the basics: cleanser, moisturizer, and sunscreen, and then you treat specific things as you go on. So initially when I started, that's what I just did: cleanser, moisturizer, and sunscreen. And then in between putting my moisturizer on, after cleansing my face, that's when I start to introduce a little bit of an active ingredient. And during the day, in the mornings I use vitamin C, and at night I use retinol. I'm turning 29 soon, and apparently it's good to start to get on your retinol as soon as possible. And so I started with the lowest concentration possible, because my skin wasn't used to retinol. There's one thing I want to add. Like I said, I have really dry skin, so I use this product. I don't know if you can see it. It's Medicate Hydra 8B5 Intense. It was very nice. Oh my god, it was very moisturizing for my skin. Like, whenever I used it, you just let it sit in for a bit and then apply your moisturizer after. I really liked it. It's just that this one is finished. I need to get another one. So yeah, that used to help with my dry skin as well. So you don't want to introduce too many active ingredients at the same time. You just want to keep it basic, because skincare is a marathon, not a sprint. It's something you want to do consistently. Bear in mind that it can take months, weeks, months before you even start to see any significant change in your skin. So it's something that you need to do consistently. Looking at this pyramid, you start with daily. You want to do your daily skincare routine, which is, like I said, keep it basic, expand as necessary, introduce an active ingredient slowly. Then weekly, you want to exfoliate, so you can put in a face mask at home. You can do this at home. You can just do this as a little bit of self-care. And then monthly, you try to get your facials. I'm not going to lie, I've never had a facial done. A friend of mine who did her facials, she was like, it was so painful. I'm actually looking forward to having one. Yes, I'm actually looking forward to having one, because there's a limit to how much skincare can actually do. You need to get regular facials. So monthly, you want to get your facials done. Allow me to end this whole video by talking about lifestyle. Honestly, your lifestyle really does affect your skin. Smoking, drinking, excess exposure to the sun, not exercising, not eating properly, these things take a toll on your skin, and they tend to show in the long term. Even not drinking enough water, in the long term, this accumulation of poor lifestyle choices accumulate and then show in the skin. So yes, I hope I've been able to like summarize and keep it simple. Don't get too overwhelmed. There's a lot of information, and if you have an active skin issue, it's worth seeing a professional, you know, a dermatologist, see your doctor. Someone specific can help you take care of these issues and walk through, because like I said, skincare is a marathon, not a sprint. Thanks for getting to the end of this video. I will see you in my next video. Bye.